program. Dr. Yesh Navalgund is one of the country's most respected authorities on interventional pain management. The founder and owner of a large independent pain practice in Pittsburgh, Pennsylvania. He serves as president of the Pennsylvania Pain Society and as a faculty member at the Rockefeller Neuroscience Institute. We recently spoke with him about the clinically validated outcomes for the VX Pain Relief Program.
There's numerous positive outcomes that have been shown with the use of VX therapy. A recent cohort study looking at the outcomes of patients with VX therapy has really pointed out several key findings. The first is almost 50% reduction in pain while using the VX therapy. We've seen a reduction in opiate use of about 50% while using the therapy as well. One of the key findings that's differentiating for the VX therapy is the time to benefit. So with typical opiates, it could be 45 minutes to an hour before really finding the benefits. But the VX therapy, we're seeing benefits immediately. So as soon as they put on their headset, begin the therapy sessions, they start to immediately notice pain relief. One of the very common questions that I get from my patients is, well, that's great, but what happens when I take the headset off? And we looked at that, and we really dove deep into finding out whether or not there's any lasting effects. So as we monitored these patients, at the beginning of their therapy, we noticed that there was an average of about 2.5 hours of relief after the therapy was discontinued. But as we go through the entire program, by the end of the program, patients were getting 3+ hours of relief after using the therapy. Other findings that we found were very important to look at, and that was the average daily hours thinking about pain. What we discovered at the beginning of the program, that patients were averaging well over 12 hours of their day, basically half of a full day spent thinking about pain. By the end of the therapy, we found that there was a legacy effect that took place, and that is that patients reduced the amount of time thinking about pain in more than half. Greater than 7 hours were shaved off of that time, making it closer to 5.5 hours than 12.5 hours. So I think that's an important finding because it does allow the patients to spend more time thinking about more positive things and other aspects of their life other than the pain they're experiencing. Some of the more profound outcomes discovered during the cohort study were actually patient self-reported goals. Now, these are patients that were injured at work and have various reasons that potentially didn't want to return to work. And to watch their self-reported goals was a key factor in providing the benefit of this therapy. What we discovered with these patients looking at self-reported goals was that there was over 100% increase in the quality and duration of sleep. We all know, again, pain is multifactorial. Sleep is one of the most important components of reduction in pain and improvement in anxiety and quality of life. Other things that we looked at were behavior-based goals, close to 300% improvement in their behavior-based goals. Additionally, when we looked at physical and mobility-related goals, we saw almost 350% improvement in these patients. But most importantly was the social aspects and the social goals that the patients had. And we saw close to a 400% improvement in the social goals. And I think that not only the patients were pleased by this, but their families and their loved ones as well. We have clear evidence by way of clinically validated outcomes that there's overall improvement in the lives of patients. The multimodal aspects of pain management, including the biopsychosocial aspects of the patient's lives, really demonstrates how well the VX product works. The reduction in fatigue, the improvement in sleep, all of these, again, add to the benefits of the therapy.
Harvard MedTech,